In the UK, depending on what kind of mental health problems you are experiencing, generally your GP or a psychiatrist may give you a mental health diagnosis. Although the word assessment is used in mental health assessment, it isn't a real test. It's to gain an understanding of what you are experiencing in relation to your mental health in order to see what support may be available to you. What happens during a mental health assessment? During a mental health assessment with a GP, details of your experiences of mental health problems will be explored. You may complete a form together, have a chat about your feelings, thoughts, actions, your general well-being, and things that may be negatively impacting your mental health, such as financial worries or problems in relationships. You may also talk about things that have possibly helped you in the past or that are helping you currently, and you may explore your aspirations for the future. Assessments provide a wider picture regarding your mental health and emotional state, and can provide information about whether or not a mental health diagnosis is applicable. What does receiving a mental health diagnosis mean for you? You may respond positively, as a diagnosis can open up avenues for support that you might have struggled to access without. Receiving a diagnosis may feel validating. For example, as symptoms or indicators of mental illness are often invisible, but pain and discomfort can be felt internally. Receiving a diagnosis may validate your experience. On the other hand, you may feel distressed or shocked at receiving a diagnosis. You may view this as a negative for different reasons. For example, you may feel disempowered or stigmatized. You or others around you may hold negative views toward mental health diagnosis, so it may be challenging when it comes to seeking support. Stigma can have a negative impact on your mental health, and you may feel hopeless and ashamed. Increasing understanding about mental health conditions may reduce stereotyping and challenge inaccurate misconceptions. There is nothing to be ashamed of, and perhaps speaking to someone who is understanding may increase your self-esteem and provide a boost to your well-being. Diagnosis and medication. If you have received a mental health diagnosis, you may be advised to take medication. Examples of types of medication that are prescribed for mental health conditions include anti-anxiety drugs, antidepressants, antipsychotics, and mood stabilizers. Though medication can help, this may not address some of the struggles that you may be experiencing. In these cases, counselling or psychotherapy may help. Therapy may help you to feel like you are regaining control over your life, feel empowered. It could help you to identify factors contributing to your distress. For those who have been given the same diagnosis, this doesn't necessarily mean that they're experiencing the same things, and may respond differently to different forms of support. If you are struggling with your mental health, it's about finding the right thing that works for you. I think it's important to remember that a diagnosis does not define you as a person, and there is support out there.